If you have ever wondered about a complete online EHR portal for hospitals and doctors, 75health.com is the perfect solution. Its light density, fast operations, reliable security and easy adaptability makes it a one-of-its-kind solution in the industry. Doctor section. Logging in as an administrator takes you to the doctor page where we can view doctors list. Only the administrator or user with required privilege is entitled to view and create a doctor in the 75health.com EHR system. This is how the doctor page would look like. The doctor page displays the list of doctors practicing in a hospital. You can search doctor by their name, phone number, address or even by their unique KPID. For example, typing the name Kumar in the search box would display the list of all the names that contain Kumar in part or in full, using the autocomplete feature. Choosing the name of your choice from the list would take you to the page that displays the chosen doctor's information, their personal and contact details. You can also edit any of the details on this page if required and save it. Clicking the new icon enables the user to create a new doctor in the hospital. The mail address, first name and last name are mandatory fields to creating a new doctor. A verification mail will be sent to the given mail address, enabling the new doctor to create a password for themselves for future login purposes on 75health.com. All details entered can be saved on the new doctor's page. The doctor can also add a profile picture, fill in the personal and contact details and save them. Patient section. The list of patients in the account can be viewed only by the administrator or doctor or any user with the required privilege. Clicking the list icon in the home page lists all current patients' accounts. A patient's details can be searched by using either the patient's name, phone number, address, ID. For example, typing the number 3006 would bring up a list of patients containing that number within their name, mail ID, phone number or KPID. With the edit option in place, the user can edit a particular patient's personal and contact details and save it on their system. New patient. The new icon on the left allows the user to create a new patient profile or register a patient in the system. Upon registering their mail ID, the patient is able to create their user ID with a password. This enables them to view their name and medical records existing in the EHR system. Once a basic account is created, with the edit option, the user can add the complete details of the patient. The patient details and the contact details of the patient can be entered into their respective systems. Family Health History section is used to enter information on the patient's family health history. The Need Help option on the right can be referred for any help required in filling out the details. Clicking on the Add Family Health History button allows the user to enter and save details of relationships to the patient and their diagnosis. The details can also be edited at a later time if necessary. In the Social Habits section, details of the patient's habits such as smoking or eating may be entered. The type of habit, its description and duration can be entered and saved. The Allergy section allows the user to enter and save the patient's allergy details. If the allergy pertains to a drug, the drug ID and its potential reaction could be entered and saved. The Vaccination and Immunization section allows you to enter vaccination and immunization details of babies and infants. Clicking on Add Vaccine will enable you to set a vaccination reminder for a future date. Enter details of the vaccine that has to be administered with or without the CVX code along with the description and save them. Patient Medical Record section. Medical History. The Medical History section displays the medical history of a patient. A patient can be searched by his name, phone number, address or their KPID. Choosing a particular patient by clicking takes us into the details of the particular patient's medical history. The New Medical Record button allows the doctor to create a new medical record for the new visit of a patient. Details of the patient's reason for their visit are entered in the Patient Visit Reason field. The Vitals field is used to enter the patient's vital information in any format. The Doctor Delivery Notes field allows the doctor to enter any closing comments and save the record. The Symptoms section can be used to enter the symptoms of a patient as assessed by the doctor. To add a symptom, simply click on Add Symptom and enter the details of the symptom with or without using the ICD code. The start date and description of symptom can also be recorded. The Diagnosis section under Medical History is used to enter the doctor's prognosis based on the symptoms. It can be entered with or without using the ICD code, followed by the description, date diagnosed and saved. The Prescription section is used to prescribe drugs by a doctor. A doctor name entered even on a single occasion is captured by the autocomplete feature, enabling its predictability when it is entered again. The drug name, its strength, directions for use, quantity of intake and refill status are entered and saved here. The Procedure section under Medical Record allows the doctor to enter the details of the procedure performed on the patient. The doctor can select the appropriate type, choose the particular procedure and enter its description in the field provided. If a procedure is complete, the completed checkbox is ticked and the results are entered and saved. Clicking on Print Procedure allows printing of the selected rows in a single click. The Test Order section under Medical Record consists of lab tests that may have to be taken to determine the health statistics of a patient. The doctor can select the appropriate test order, write a description, enter a result and save the details. LOINC are a set of universal codes and names that identify laboratory and other clinical observations meant to facilitate exchange and pooling of results for clinical quality measures, outcomes management and research. Use of LOINC codes will foster the development and use of suitable standardized diagnostic test and procedure terminologies to support safe, accurate and effective exchange of health information. Currently, healthcare providers are required to use LOINC codes when reportable disease results are sent to the state and central public health laboratories. Inpatient. The Inpatient section under Medical Record is to enter and save the patient's date of admission, date of discharge and the doctor's discharge summary. File Attachment. The file attachment is a handy feature that is used to attach scanned reports or PDF documents for future references. Clicking Attach File option allows the desired file to be selected and attached. Files can also be attached using the drag and drop option. Receipt. The Receipt section allows a user to bill the patient for a service. Clicking on Add Item will lead to the main page of the Receipt section. The down arrow next to the item field would reveal the top 25 items used by the doctors, allowing easy selection of an item. Its pricing can be entered against the respective field and saved. down arrow on the top right side enables the doctors to customize the layout of medical history screen by selecting or unselecting the accordions from the list. The doctor can click the complete button followed by his registered password, which ensures that the patient's medical record is completed. No changes can be made once the medical record has been completed. Receipt section. The receipt option seen at the top of the page enables a doctor to view the list of receipts drawn by the doctor. The search option can be set to today, this month and this year. This allows the user to view the records corresponding to the selected time frame. The custom date option allows to set the start date and end date. This displays a list of records for a certain time frame defined in the start and end dates. The print option will print out list of all patients displaying the date of the receipt number, the patient name and the amount against each. Appointment section. Permissions to access the appointment section is provided only to the administrator or doctor or any user with required privilege for patient appointments. A doctor can be selected either by name, phone number or address. Once a doctor is selected, a date for the appointment can be scheduled from the calendar provided next to it. A patient can schedule an online appointment depending on the doctor's availability on a particular date using the Allow Web Appointment option. In turn, a potential duration of examination for a patient depending on a doctor's available timings during a day can be allotted by the user. This is how a doctor's schedule would appear in the appointment section of the doctor's account. The print option allows to take printout for current as well as future appointments. Settings section. The settings section allows editing of the account settings. The edit profile option allows the signed-in member to edit the profile picture, personal details and contact details. Clicking the respective field will allow the user to edit it. The Change Your Password option will allow the user to change their password as desired. The frequently used values will allow doctors to set their preferences on drug, test order, vaccine and receipt. Using the Set Frequency Use Drug option, the doctor can add a drug as well as delete any of the drug. The Set Frequently Used Test Order allows the user to set preferences on test order. The Set Frequently Used Vaccine is used to set vaccination preferences, and the Set Frequently Used Receipt item allows customization of the receipt items. The Customize Your EHR is similar to the down arrow displayed on the visit page and is used to select or deselect the accordions. The page size is used to specify the number of rows to be displayed per page while viewing the patient's list. A logo can be uploaded or changed at the logo section, and the logo would appear on every printout obtained by the doctor. User section. Users are persons authorized by administrator to manage accounts on their behalf. Create New User under Manage Users section can be used to create a new user by the administrator. The List User option displays a list of existing users allocated by the administrator. Clicking on a user will display the account details of a particular user. The Edit option below can be used to edit the account. 75health.com is an extremely user-friendly software that can be managed effortlessly. The left side menu consists of patient, medical history, appointment, receipt, settings, health and sign-out sections. The help section on the left-hand side menu or on the top of the page can be accessed at any time for help required on topics related to getting started, patient, doctor, doctor appointment schedule, doctor's appointment, patient medical record, user, settings and FAQs. Chat online help is another key feature that offers a 24/7 online support on any topic relating to 75health.com. You can also access 75health.com through Facebook, Twitter and Google+. 75health.com really is a complete online EHR package offering a convenient way to exchange medical history through cloud computing. Its customizable options, flexibility and design makes it one of the best solution providers in the medical field.